Welcome to a presentation about laryngectomy and tracheoesophageal puncture brought to you by your neighborhood doctors. Please remember that we will cover the topic in general terms. Please consult your doctors for specific questions pertaining to you. An analogy for laryngectomy and tracheoesophageal puncture is like a garden hose. The larynx is like the hose, and the tracheoesophageal puncture is like a hole in the hose. The hole allows air to pass through, but it also allows food and liquids to pass through as well. In a laryngectomy, the larynx is removed, so there is no longer a hose for air to pass through. The tracheoesophageal puncture creates an artificial opening between the throat and the stomach, allowing air to pass through while also allowing food and liquids to pass through as well. A laryngectomy is a surgical procedure that removes all or part of the larynx, which is the voice box. Symptoms of this condition can include difficulty speaking, difficulty swallowing, and a hoarse or raspy voice. Other symptoms may include coughing, shortness of breath, and a feeling of something stuck in the throat. In some cases, patients may also experience pain in the neck or throat area. Tracheoesophageal puncture, TEP, is a procedure that creates an opening between the trachea and esophagus to allow air to pass from the trachea into the esophagus. Symptoms of this condition can include difficulty swallowing, coughing, and shortness of breath. Other symptoms may include pain in the neck or throat area, as well as a feeling of something stuck in the throat. A laryngectomy is a surgical procedure that removes all or part of the larynx, which is the voice box. It is most commonly performed to treat cancer of the larynx, but can also be used to treat other conditions such as vocal cord paralysis or severe trauma. Tracheoesophageal puncture, TEP, is a procedure that creates an opening between the trachea and esophagus. This allows for direct communication between the two organs and can be used to restore speech in patients who have had a laryngectomy. Demographically, laryngectomies are most commonly performed on older adults, with the average age of patients being around 65 years old. Men are more likely than women to undergo this procedure due to higher rates of smoking and alcohol consumption in men. Additionally, people who live in rural areas are more likely to receive a laryngectomy than those living in urban areas due to limited access to medical care in rural areas. TEP are also most commonly performed on older adults, with an average age of around 65 years old. However, they are more evenly distributed between men and women than laryngectomies due to their use for restoring speech after a laryngectomy. Additionally, TEP are more common in urban areas due to better access to medical care and specialized surgeons who can perform this procedure. A laryngectomy is a surgical procedure that removes all or part of the larynx, which is the voice box. Tracheoesophageal puncture, TEP, is a procedure that creates an opening between the trachea and esophagus to allow air to pass from the trachea into the esophagus. The cause of these conditions can vary depending on the individual. In some cases, it may be due to cancer of the larynx or throat or due to trauma or infection. Other causes may include congenital defects such as a cleft palate or vocal cord paralysis. In some cases, a laryngectomy may be recommended as a preventative measure for people at high risk of developing throat cancer. Treatment for laryngectomy and tracheoesophageal puncture typically involves surgery. During the procedure, the surgeon will remove the larynx, voice box, and create a new opening in the neck to allow air to enter the lungs. The surgeon may also create a new opening between the trachea, windpipe, and esophagus, food pipe. This is known as a tracheoesophageal puncture. After surgery, you may need to use a speaking valve or an artificial larynx to help you speak. You may also need to use a stoma cover or other device to protect your stoma, the opening in your neck. You may also need speech therapy after surgery to help you learn how to speak with your new voice. You may also need physical therapy to help you regain strength and mobility in your neck and shoulders. Your doctor will likely recommend that you follow up with regular checkups after surgery, as well as lifestyle changes such as quitting smoking, eating healthy foods, and exercising regularly. The prognosis of laryngectomy and tracheoesophageal puncture is generally good. Most patients who undergo this procedure experience improved quality of life and are able to return to their normal activities. The risk of complications is low, but there is a chance that the patient may experience some difficulty with speaking or swallowing. In some cases, the patient may need to use a voice prosthesis or other device to help them communicate. With proper follow-up care and monitoring, most patients can expect a positive outcome from this procedure. Thank you for listening to this presentation brought to you by Talking Raymond. For information, check us out retinally.com/info. Be safe. Love you.